You can now purchase health insurance plans in the health reform marketplace. I'm Bryn McBride of ABC for Health.
And I'm Ryan Stasel. We're going to take you through a walkthrough of HealthCare.Gov and show you just how easy it is to purchase a plan on HealthCare.Gov.
And there are two ways to get started, Ryan. If people had a health insurance plan through the marketplace, this is HealthCare.Gov, also called the individual marketplace. If you had a plan in 2017, you can log in with a username and password you created last time you purchased insurance, and you can look at the plan you have, decide if it's available in the next coming year, and you can renew or shop that way. If you're brand new to the health insurance marketplace, there's a separate button for you to click, and you're going to click to get started, and Ryan's going to take us through this right now. Take the first steps to apply. And what you're actually doing is creating a user profile first before you start looking at plans and your plan options. So you're going to create an account. So you're first going to select your state. We're in the state of Wisconsin. We use the federally facilitated marketplace. So we're going to select that from the pull-down menu. This already, right out of the gate, is narrowing your insurance options to just that available in Wisconsin. The more information you give it, the more it's going to narrow to just your region. When you first sign up, this is just like any other shopping experience online. You're going to create a username, you're going to create a password, you're going to have to set 3 security questions, you're going to enter an email address, and then you're going to agree to some terms and conditions. And this is actually important for people to take a quick look at. When you're applying for health insurance through the marketplace, you're sharing a lot of personal information. And these privacy protections that they offer are worth you knowing about. They won't be sharing your personal information with other outside entities. They will be comparing your information to other federal agencies like Social Security, the IRS. It's going to be verifying your identity and some of the information you enter. So if you have concerns or you want to review that information, you have the opportunity to do that before you even start the application. So Ryan would fill in his username, his password, and he's also going to write it down separately. This is your key back into the marketplace right out of the gate. Once you click Create My Account, you're going to get an email to that email address you entered that's going to have you verify your identity, verify, yep, that's me, I just started the application process. It's going to have a link in that email that you click, and then that's going to prompt you to a brand new login. You're going to enter that username and password you just created, and now you're on your way to shopping for insurance. It's going to ask a couple questions right out of the gate. You enter your username and password. It's going to ask to verify your full address and things like your social security number and a couple other questions. And that's already starting to go through some of the eligibility criteria for plans. Part of it is narrowing you to that network that you're going to be shopping in, but part of it is also connecting your information to the IRS and Social Security to make sure that we're talking about the same person. That's why Social Security number is important. It's also going to see if you're eligible based on immigration status. You simply need to be legally present in the United States, either a citizen, a legal permanent resident, on a different kind of visa, a student visa, a fiancé visa, a worker visa. Any kind of legally present status will make you eligible to shop in HealthCare.Gov.
That's good to know.
It is. And so some people get a little scared by that Social Security number question.
Sure.
What it's actually doing is pairing you up with Social Security if you are a citizen, or it's going to later then ask you what kind of visa or other qualifying status you have. So that's why you're going through all of that on the front end. This process from start to finish should take about an hour, so make sure you have some time set aside to devote and take the time to read the stuff that pops up on the screen. It's going to actually make this process a little bit more efficient. It's going to tell you how you can look for more information, how you can compare plans, what some of the numbers mean, and some of that's going to be helpful so you fully understand what your options are. And it's also going to tell you if all of a sudden you've fallen out of eligibility based on how you've answered a question. So you want to make sure you devote that full hour, and it might not take that long. If you know what you're looking for right out of the gate, it might be a little bit faster. The application process is really 2 parts. You're answering questions about your financial eligibility, which really sees if you're eligible for things like tax subsidies or cost sharing reductions, so either premium support or support on the deductible and out-of-pocket side, and then you're actually going to be picking a plan. So your time here is going to be well spent if you really go slowly through it, understand what you're clicking, and understanding what kind of cost savings and other things are coming your way. So let's now fast forward. We've entered your personal information, we've verified your Social Security number, we've answered a couple questions about where you live, and now let's start looking at plans. So Brian's going to fast forward us through, and we're going to narrow our network and say we're in Wisconsin, and we're right in our state's capital, we're in Madison. It's going to say, do you mean Dane County, Wisconsin? And we're going to say, that's the one. And now here's another opportunity. Even though we already said we're shopping for a new plan, it's going to say, were you enrolled in a 2017 plan? Because it wants to know if it's going to take you down that path of renewing or looking for a plan that's similar to the one you had, or if you're starting fresh. So we're going to say, no, we weren't in the marketplace in 2017. We're starting fresh. We want a plan that starts January 1st, 2018. So we're going to say, no, we weren't in the marketplace in 2017, but we want to be in it in 2018. And now it's going to start answering some of those questions about household. Is it just you? Are there other household members? It gives you the opportunity to spell out the household members, and it's looking at tax dependencies. So if it's you and the 2 children you claim in your household, on your taxes, that's the way you answer this question. If it's you and your 2 children and your mother lives with you, but you don't claim her as a tax dependent, you won't be counting her as a household member. So there will be prompts as you enter your household information to make sure you get that number right. Household is important. That number is important because the household is compared to your household income, and those 2 numbers together make the federal poverty level percentage. So this will tell you essentially if you're eligible for tax subsidies and cost sharing reductions because there are different cutoff thresholds for those 2 information. We have our materials here. We got organized before we started to apply. So we have last year's taxes. We have information on the social security numbers of people in our house. And we have their birth dates. All of that, when you enter someone as a household number, you're going to have to put their birth date, their social security number. You're going to put all that down. So get organized in advance. Have last year's taxes handy. It's going to be really quick. So why don't you tell us what you're clicking on?
So yeah, so we're talking about who's in our household. For the sake of this example, I'm just going to say me.
It's just you.
And you'll notice all the buttons to navigate HealthCare.Gov are green, which is a great visual indicator of how to get to the end.
Green means go.
Green means go. So let's go. So for my age, I'm going to put that I'm 30.
Happy birthday.
For sex, I am male.
And now this is an interesting set of questions here. It's asking if you have other coverage. Do you have Medicare? Do you have Medicaid? Do you have insurance through your work? This doesn't mean you're not eligible necessarily for the marketplace. It might mean that you're not eligible for tax credits or other cost savings because you would be considered to have other qualifying health coverage. So it's going to ask that right out of the gate. Are you eligible for health coverage through Medicaid or through Medicare Plus in Wisconsin? If you were to say yes, you could also buy health insurance, but you wouldn't get the tax subsidies. So that's sorting that out right out of the gate.
Okay.
It's asking if you're pregnant, a parent of a child under 19, because then it's going to answer additional questions about your children. It's asking if you're pregnant or if you're a tobacco user. Answer these questions. Honestly, if you're a tobacco user, there is a tobacco surcharge in the marketplace. So it's going to ask you more information about your tobacco use. This is one of those health promotion strategies that was part of the Affordable Care Act. So as a smoking cessation strategy, they want to identify people that are smoking. They might offer, some plans offer some strategies to help you quit smoking or reduce your smoking or your tobacco use if that's a strategy you'd like to do for wellness. So it's going to ask you that right out of the gate. Some people get a little startled by these questions, but it's always good to know why they're asking those questions.
Sure, and be honest, right?
And to be honest, yeah. And we didn't answer any of those. You're not a parent of a minor children. You're not a tobacco user. So we skipped those, left them blank, and hit continue. Now it's just going to do some confirmation steps. This is a chance to go in and edit. If you type something wrong, if you typed it too fast, you always have an opportunity to edit your question. And if you like the answer, you can hit continue.
So for my expected income for 2018, for the sake of this example, we're going to put $30,000. Just so we can show you some of the tax credits that are available to us.
It shows you, and this is a really nice feature, because there's been so much chatter about the cost of health insurance. Costs are rising, premiums went up X% in my state. But for a lot of people that fall under 400% of the federal poverty level, if you're between 100 and 400%, you're eligible for tax subsidies. So you might not feel that premium increase. Tax subsidies will bring down your monthly premium. So you give your age, your expected annual income, and it right out of the gate is saying, guess what? Based on what you just told us, you qualify for a premium tax credit of $199 per month. So you see this even before you see any plans. So it's saying, yeah, you're one of those people that's going to qualify for tax subsidies, and it's going to be almost $200 a month that you qualify for. That will then be applied to the prices of some of the plans that you see once we progress through this. At the very bottom of the screen that we're looking at, in very small print, but it's still, this is why it's worth reading. It's giving us an instruction right out of the gate. Guess what? You might be eligible for extra savings if you pick a silver plan. If you're between 100 and 250% of the federal poverty level and you pick a silver level plan, you will be eligible for some reduced deductibles, copays, and out-of-pocket costs. It's going to bring those costs down. Now, a silver level plan, some people are probably saying, what does that mean? The marketplace breaks up health insurance by category, and they give metal designations to those categories: gold, silver, bronze, and then for a little bit higher quality, platinum. If you look at all of those plans and you pick silver, then you can get this out-of-pocket savings. They're called cost-sharing reductions, and that can be applied to a silver plan. Now, should you lean towards a silver plan because of this? And the instruction here is to really look at the plans that are being offered. This year, because of a lot of the political chatter and some of the rules that have changed, some of the insurance industry practices that are different, you actually might find a cheaper plan without this extra cost savings, and it might be a gold plan. There are instances in the marketplace where gold is cheaper than silver, which is a little counterintuitive, but this is why it matters to look at those plans and to shop and read everything on the screen in front of you. So we know we're going to get tax subsidies. We know if we buy a silver plan based on our income that we entered, we might be able to get some out-of-pocket savings. So Brian's going to click continue, and we're going to now see what we've got. It's summarizing what we've done.
Right.
You're going to see this a lot. You're going to see you enter something, it has you review it. You enter something, it has you review it.
Which is good, though, in case you make a typo.
Because there's consequences to entering this wrong.
That's right.
You are estimating your household income. It's an opportunity to make a really close estimate. If you're really far off on your estimate, if you said, oh no, I think I'm going to make $100,000 this year, well, there could be tax consequences later. If you got tax credits and you shouldn't have, you'll have to repay them. If you didn't get tax credits and you should have, they owe you that money. So there will be a reconciliation process at tax time, but it's still worth making sure you get really close on these early questions. So you like what you answered.
The moment we've all been waiting for, let's
look at some plans.
look at some plans. We made it.
We made it. So like I said, they're going to be pop-ups, but these are helpful. So they have a little information button next to some of the plans. You can hover or click on that, and it can actually answer some questions. If it says deductible and you say, I don't know what that means, it's going to give you a definition. You can refine your results. You can always filter this down. In some areas, people might see upwards of 70 plan options if you're looking at all the metal tiers. If you want to say, I just want to see some of those plans that have very low premiums, you could sift it down by cost, or you can sift it by silver plans. So it's going to give you an opportunity to filter your results. Some areas, unfortunately, where there only is one or two plans in the marketplace, doesn't do you much good to refine those results. You want to see everything that's there. There is a compare feature. You can compare up to 3 plans at any time. If you're sifting through your many options and you're like, oh, that one looks kind of nice, why don't I see how that compares to that other plan I saw before? You can select, and it's going to actually put them side by side, and that's a great sifting down feature. That's a really good opportunity to say, like, oh, this one's like $2 more a month, but it has these extra benefits. Yeah, so that's a really great way to compare and contrast. So this pop-up that we just saw is actually giving you an opportunity to learn a little bit more about what all of these buttons look like. It can be a little intimidating when you see all of these buttons pop up. All of the plans have compare. You can like the plan. You can do a quick view of the plan. You can see more plan details. There's a lot of information in this one website, so it's good to know what you're looking at. And it gives you, when you click next, it gave us one last reminder of those metal tiers. What does it mean to be a bronze, a silver, a gold, or a platinum tiered plan? So this was a reminder of what that means. It's really actuarial value. This is a little behind the scenes, deep in the weeds actuarial baseball of how all of this, how they assign the number and the premium to the plan. All the plans have to cover essential health benefits. So it's not that a bronze plan would be really poor coverage compared to a gold plan. It just might be a little bit different actuarial value to that plan. So all of these plans are going to have essential health benefits. They can't discriminate against pre-existing conditions. They have to cover things like maternity and newborn coverage, no matter what. And then what you're really looking at is just the price overall for that premium and the cost savings reductions. Okay, so Ryan's going to click next. We reviewed, we know. Okay, now here's a step where people should pause a little bit. You can do a big filter of plans right out of the gate. You can pick only simple choice plans, or it's going to say, or see all plans. Now, if you're in a hurry, this might be an opportunity for you to do a big filter, see just the simple choice plans and click next and keep going. I would encourage people to see all plans. I think this is a better shopping experience. You learn more and you know more about the price, the networks, the cost, your responsibility, their responsibility. If you actually see all of the plans that are available, I think it's worth seeing all plans and doing your own filtering, sorting by price or sorting by network. Or by metal tier, you can do that on the next page. So I would skip the simple choice filter. I would see all plans and then do my own filtering once we get into the full listing of all the plans that are available. So Ryan said see all plans, and you can see up at the top, it's telling us we have 66 plans available based on the zip code that we entered. It's going to start giving you we'll just look at the very top one. It's telling you the insurance company itself. It's telling you the name of the plan, and the metal tier will be included in the name of the plan. And right under that, you're getting full disclosure and full transparency of all of the prices. So this is really a nice feature where you can see all of the prices. You can see some tabs up across the top where it's letting us filter by plan type. You can buy a dental plan out of here as well, but we are looking just at health plans today. You can sort by premium right out of the gate. You can sort by deductible, and the deductible is your out-of-pocket expense. And then you can hit refine results, and if you entered any of those search terms, it's going to narrow it down for you. There's also a couple opportunities to work in that.
This gets pretty deep in the weeds too, so you can see all the options that are available to you. For the sake of this example, we're going to keep it simple.
We're going to go back.
We're going to go back.
So we're looking at our plans. Let's stay on that top one and click. You'll see there's details in quick view, compare, or like this plan. Let's click on quick view.
Okay.
So you're actually getting just a little bit more information about the plan. It even includes an overall plan rating in this. You can actually then hover and see what that means if you're not familiar. But it's giving you more detail on the plan, a refresher of what some of those costs are, some of your co-insurance, your co-payments. And if you scroll down, Ryan, just a little bit, you can now click compare, and it's going to ask you what you want to compare it to. And we could pick another plan if we wanted to. And like we said, you can pick up to 3. But also, if you read this plan and you're like, this is the one I want, I like this, you can either write that plan number down or go ahead and click enroll right from the screen. If you found a plan you've landed on that you like and you want to make that one the one that you're going to sign up for, click enroll, and now you're going through the rest of the application process to enter the rest of your financial information and your enrollment information, and that's your plan. If you find a plan you like, write that plan number down, the name of it, the title, the metal tier, and the several digits after that.
The plan ID?
The plan ID number is the one you're going to want to keep handy. This is going to come in handy for a couple different reasons. First of all, to make sure that when you do start getting information from your insurer, it matches. We just want to make sure there are no mistakes. But if you're in an area that offers premium assistance outside the marketplace, so we're in Dane County, Wisconsin, there's a program called Health Connect in Dane County, Wisconsin that offers some premium assistance for people that have purchased a silver plan. If we purchased this plan and it was a silver plan, it was a qualifying plan, they would have us enter that plan ID to make sure it was a qualifying plan for assistance. Yeah, that's the number you enter. So you're keeping good notes through this whole process. Staying organized, keeping good notes is so critical to making this an easier process. So you're just taking good notes. You're writing the plan ID down. You're writing your passwords down. Any notes along the way. It's all to keep your notebook handy. Put that in the file folder with that tax information and the household information you have, and that's now your health insurance binder for next year also, so that you can stay organized. So a couple extra steps to help keep you organized, but it's going to be worth it. It's going to save time later, and it also might make sure you're getting some of those extra benefits you're eligible for if you're one of those areas that goes that route. So why don't you close out of this plan? If you just scroll down a little bit, you'll see the extent of some of the plans that are offered. It goes through the metal tier, some bronze plans. It starts getting into some gold level plans. Some out-of-pocket maximums are listed as well if you have out-of-pocket costs. And you can see in the area that we've selected, 66 plan options available. You clicked compare, so we now have a plan up at the top that if we now select any other plan to compare it against, it's going to tell us now we have 2 plans to compare. You can look at those 2 side by side. And this is a really great shopping tool. I wish more websites had this. I'm like, you looked at this sweater, and then you looked at this one, and here's how they're the same, and here's how they're different. This is how the price is different. Here's some of the conveniences that are offered. It's a really great, quick tip. I mean, and look at the plans that you just clicked on. One's a bronze tier, They're both bronze tier plans, but from different providers. We're seeing a dramatic difference in price for the premium, a little bit closer deductible, very similar out-of-pocket maximum. So if you're just looking at prices, that's one way to compare. But both of these plans you clicked on from two different insurance companies, which means two different networks. So if you know the name of your doctor and where you're used to getting care, you can see if your doctor now fits into one of these plans. And it's going to give you more information for primary care visits, what it's all included, what it means to have laboratory and some of those outpatient visits. It's going to do that line by line so you can compare the services. And it's just a really great comparison feature. Like we said, make sure you have plenty of time to actually do this right. Once open enrollment closes, if you pick a plan, once open enrollment closes, you are locked in. So by December 15th, you are locked in to the plan that you select with no opportunity to change unless there is a special enrollment period later. Now that is only triggered by things like you got married, you moved, there's a dramatic change in your life. So there are 10 qualifying events for a special enrollment period. If you don't have one of those qualifying events, this is your plan for all of 2018. So it's a good idea to spend the time now to make sure that you've made that right selection.
I mean, that's
it.
That's pretty much it. Yeah, it's pretty easy.
It can be intimidating because of all of these options, all of the numbers, all of the different tiers of plans.
Yeah.
But once you get into it, take the time to actually shop, click around, and get comfortable with it. Do some of those side-by-side comparisons. If you find one you like, go ahead and like the plan. It's going to kind of save it for you. Or once you've visited the details of the plan, you can click right on the enroll button and finish your application. Now, sometimes people might have to take a couple more steps. This would be in an instance where you might have to do some verifications. If you have to verify income or if you have to verify identity, you will get a notice from the marketplace saying you're not done. There are a couple more steps you have to take. And the only advice we can give there is to make sure you answer the questions truthfully and honestly and quickly. You want to make sure you have your verifications in a very fast, don't hold on and wait until March of next year to get those in. It's too late by then. You have to verify the questions that they ask very quickly. If it is prompted, you are prompted to do so. And at the same time, keep copies of things. If you're sending in something like a pay stub to verify income or they ask for something specifically, keep a copy, send a copy. Because if they say, come back later, we know that human error happens. If you send something in and they say we never got it, you lose your opportunity for coverage. You have to make sure that you can send it in again if you need to. Keep a copy, send a copy if there's ever a verification that's requested.
So, Bryn, after this entire process, let's say we went through the whole thing. We purchased a plan on HealthCare.Gov. When does that coverage begin?
You're buying a plan that starts January 1st, 2018. This is calendar year 2018 coverage. So this means that if you purchase now, if you purchase in the month of November, you have November 1st through December 15th. You then have to wait until January 1st for that coverage to be active. And one other reminder, you will purchase the plan. If you do, in fact, owe a premium, make sure you pay that premium by January 1st, 2018. You have to have coverage and you have to have it paid, and your coverage will then become active. There's very little leeway this year for missed premiums. In the past, if you missed paying a couple of premiums, they would give you a little bit of a grace period. HealthCare.Gov is not being as generous with grace periods moving forward. If you owe a premium, pay the premium as quickly as you can. Here's another wrinkle. If you owe past premiums from 2017, you're going to have to settle up before you can move forward. So if you know you owe some premiums, it might be a good time now to talk to your insurance plan, see what the liability or the balance is, and make sure that can be reconciled so that you can then go forward and purchase new coverage for 2018.
Great.
Thanks for joining us.
Yeah,
this
we
is a
appreciate
process. If you have questions, HealthCare.Gov does have a call center on that homepage, HealthCare.Gov. They do give a 1-800 number. That's a great place to call for questions. There's local help that's available also on the homepage. You can call, click the button that says Get Local Help. It's going to direct you to people in your area, no matter where you are in the nation. You can always visit us at healthwatchwisconsin.org, and we can answer more questions as well. But good luck. Stick with it.
Yeah.
Take good notes. Keep good records. And you'll be well on your way to buying insurance for 2018.
Thanks for joining us.
Bye-bye.